Welcome and greetings from Manipal. Myself, Dr. Chandrika Nayak from Manipal Academy of Higher Education. The topic to be delivered today is something to learn about vitamins in general. What are vitamins? How are they classified? What are the different examples of vitamins? That's the first part. Moving on, we will also study in depth about two important water-soluble vitamins, riboflavin and biotin. So let's move on to the biochemistry of vitamins. What are the learning objectives? The first thing is we'll try to understand the vitamin concept, an introduction to vitamins. With this knowledge, I think we will be able to understand how to define a vitamin, how to classify it, put them into groups, give examples. That will be the second set of objectives. With this, before we move on to proper examples of any vitamin, we should know this concept of vitamer and antivitamins. So, I think we will just try to give a small input on vitamins and antivitamins, and today's topic in detail about two important water-soluble vitamins, B2 or riboflavin, B7 or biotin. What are vitamins? We do keep hearing, everybody says, yes, you are eating well, but are you taking good fruits, good vegetables, fresh ones in your diet? And they intend to highlight on the concept of vitamins. The picture itself is showing you we can get vitamins from food, but they have to be fresh. So, fresh vitamins or the fresh fruits and fresh vegetables can fetch us this vitamin. Remember, vitamin is a micronutrient. It doesn't mean about the size. When we mean micronutrient, we are actually saying we need it only in small doses. So, what are vitamins? They are organic compounds. We cannot synthesize them in the body. They are essential to us. What do you mean by essential micronutrients? We cannot synthesize, we need to eat them. Why are they called micronutrients? Because their RDA or their requirement is in micrograms or milligrams. And we have to have them daily in our diet if it's water soluble vitamins. It's found in natural foods in small quantities, but you need to consume them in fresh. It's required to perform specific metabolic functions. We all know that if we ask anybody, how do you get your energy every day? We will quickly answer, I get it because I eat carbs or carbohydrates, I eat fats, I eat proteins, and that's how I get energy. But please remember, if you have to harness the energy out of carbohydrates, proteins and fats, you need to do metabolism. And for metabolism, you need enzymes. Enzymes will need coenzymes. And where are the coenzymes coming from? They are coming from vitamins. So, vitamins are vital, very important. You need to have it daily because it plays a very key role in metabolism and therefore a key role in growth and maintenance of good health. So, this is the concept of vitamins. Moving on to vitamins. I was telling you we need to learn something about vitamins. What do you mean by vitamins? It's a vitamer of a vitamin. It means different versions of the same vitamin. So, several related compounds doing the same action of one particular vitamin, you call them as a group of vitamins. So, if you see, it prevents the deficiency of that particular vitamin, and a set of vitamins of a particular vitamin do the same activity. Let us give an example for this. The vitamins of vitamin A, which are they? There are many forms of vitamin A and they do so many functions. They are retinol, retinal, retinoic acid, beta carotene, or carotenoids. All of them are vitamins of vitamin A. So, is this concept clear? What do you mean by vitamins? They are closely related forms of the same vitamin doing the same function of vitamin A. So, this collective group is called as vitamins, and I gave you the perfect example, as you can see in this slide, the vitamins of vitamin A. Moving forward, we will try to learn the vitamins of other vitamins also. So, let us classify vitamins. The vitamins are micronutrients, they are essential and they can be put into two groups based on their solubility. If it is soluble in water, you will call it water soluble vitamins, and if it is soluble in fats, you will call it fat soluble vitamins. So, how many groups of vitamins do we have? We have two groups of vitamins, and that is water soluble vitamins and fat soluble vitamins. Which are the examples of fat soluble vitamins? Please look at the slide. It is vitamin A, D, E and K. And which are the water soluble vitamins? B1 thiamine, B2 riboflavin, B3 niacin, B6 pyridoxine, B12 cobalamin, pantothenic acid is B5, biotin is B7, folic acid B9 and vitamin C. So, these are all the vitamins belonging to the water soluble group. So, we call them as the B complex vitamins and vitamin C, which come under the group of water soluble vitamins. So, what are fat soluble vitamins? Now, the fat soluble vitamins are soluble in fat. That means, if you have to absorb them from the intestine and if you have to transport them in the blood, you employ the same method what you do for dietary fats. So, absorption requires bile salts, then it will be moving in the blood. So, transport in the blood will require transporter proteins, and you have to do it with the help of chylomicrons. So, these are called as fat soluble vitamins. They have a chemical structure which is making them soluble in fat or any other organic solvents. Deficiency is rare. Why? Because you can store it in the liver. Once you can store it, deficiency is rare. But the other problem is there will be a problem of toxicity. So, please remember, where do we store the fat soluble vitamins? Mostly in the liver, but small amounts can be stored in the adipose tissue also. But the problem is, if you consume them in excess, then definitely there will be toxicity or hypervitaminosis system. So, the fat soluble vitamins includes vitamin A. Just a while ago I told you what are the forms of vitamin A: retinol, retinal, retinoic acid and beta carotene. What about vitamin D? The active version of vitamin D is called cholecalciferol or calcitriol. Vitamin E, there are many tocopherols, but the most important form is alpha tocopherol. And vitamin K, which is needed for clotting, and the most important form is menaquinone. Coming to water soluble vitamins, you can further classify them. So, water soluble vitamins, they are soluble in water, and hence if you consume them excess every day, after they are used, if it is not read, body will just excrete it out in the urine. So, we do not store the water soluble vitamins. They are easily absorbed from the intestine, they are easily transported in the blood, they are water soluble, right. So, their metabolism is easy. Toxicity is rare, we do not store them at all. So, where is the question of toxicity? And then deficiency can occur quickly. So, we need to eat water soluble vitamins in the food daily, otherwise there can be problems like deficiency. And what are the two important groups under water soluble vitamins? B complex vitamins and vitamin C. And all of them are needed as coenzymes for metabolic reactions. So, let us have a quick picture into classification of water soluble vitamins. So, we can divide water soluble vitamins into two groups. Okay. So, the first group is the non-B complex, the other one is the B complex. What is the non-B complex group called as? The best example is ascorbic acid or vitamin C. So, vitamin C or ascorbic acid is the example for non-B complex. The B complex group can be further divided into three subdivisions. The first subdivision, you call it as the energy releasing vitamins. That means they are involved in metabolism of carbohydrates, proteins and fat. What are the examples? B1, B2, B3, B5 and B7. These are all called as energy releasing vitamins. Then you have the hematopoietic vitamins. It means that these are the vitamins which are needed for erythropoiesis or hemopoiesis. That means you will need it for RBC formation or hemoglobin formation, and if these vitamins are deficient, then definitely you will have anemia problems. So, what are the examples of hematopoietic vitamins? It's folic acid and cobalamin. Of course, pyridoxine also can be called as hematopoietic, otherwise you usually put it in the other group. Okay. So, pyridoxine has partly important role in heme synthesis and therefore, it can be involved in erythropoiesis. Antivitamins. What is this concept of antivitamins? So, something that does not allow the vitamins to do its action. So, compounds that negate the biological effects of vitamins. So, they do not allow the vitamins to do their action. So, most of them are used as drugs. So, if I give you two examples, you will understand the concept of antivitamins. So, examples are warfarin, it is an anticoagulant, it is an antivitamin of vitamin K. So, people who have undergone stroke or heart attack, they will be put on warfarin. Now, what does warfarin do? It does not allow the vitamin K to do its action normally. That means, it tries to prevent the clotting of blood. And the second example, as you can see here, is methotrexate. This is used as an cancer drug. Okay. So, anti-cancer drug, that means for patients who have cancer, you can use it as chemotherapy, and that is actually trying to block the action of folic acid. So, you can call it as a antivitamin for folic acid. So, you can also call it as antifolate. So, let us begin the discussion of the two vitamins that we are supposed to study. The first one B2 riboflavin, the second one B7. So, let us begin with riboflavin or vitamin B2. It was the first B complex vitamin to be isolated in a pure state. Who did it? It was Warburg and Axel Thorel, pioneers who tried to isolate this vitamin, and later on the structure was proposed or determined by Paul Carrer. It is a heat stable vitamin. That means, even if you expose it to high temperatures, it may not be destroyed. Okay. So, that is good. That means, you can boil these food sources and still your riboflavin deficiency you will not develop, because it is a heat stable vitamin. Whereas, few other B complex vitamins, if you heat the food, then you may not get the vitamin. So, that is why we say eat fresh fruits. You can just cut it and eat it. There is no question of boiling it or heating it. So, there will not be destruction of the vitamins. So, please remember, riboflavin is heat stable. That means, even if you expose it to heat, then it will not be destroyed. And it is always found tightly bound to the enzymes. So, it has a flavin structure, and that is why any enzyme that has flavin derived coenzyme, we call them as flavoenzymes. What are the sources? What are the requirements? The sources are, if you are a vegetarian, then please stick on to green leafy vegetables, whole cereals, legumes. Then if you are non-vegetarian, then fish and liver become the important sources. Of course, dried yeast and milk is common for both the categories. What about the requirement or the RDA? So, as you can see here, for adults you will need about 1.5 milligram per day. Whereas in pregnancy and lactation or even in old age, you have to increase the intake, say about 0.2 to 0.4 mg per day. So, that was the RDA or the recommended dietary allowance. You are supposed to take it every day. So, any vitamin belonging to the water soluble group, we were discussing about B complex, and under B complex we have started with riboflavin. If it has to do its action in the body, it needs to be converted to its coenzyme form. So, what are the coenzyme derivatives of riboflavin? There are two coenzyme derivatives of riboflavin. The first one is FAD or flavin adenine dinucleotide, and the second coenzyme version of riboflavin is FMN or flavin mononucleotide. So, these are the two coenzymes of riboflavin. What is the role of FAD as coenzyme in metabolism? See, I was telling you we have to metabolize carbohydrates, proteins and lipids. And if you have to break it down or if you have to make it, you will need enzymes. And if enzymes have to show maximum activity, they depend on coenzymes. And vitamins are the source of coenzymes. So, now let us see the function of FAD. You can see here it is involved in oxidation reduction reactions. Let us pick up carbohydrate metabolism. In carbohydrate metabolism, there are many metabolic pathways or cycle. So, let us start with link reaction, that is catalyzed by pyruvate dehydrogenase complex. So, if link reaction has to happen, you will need FAD as the coenzyme. In TCA cycle or the tricarboxylic acid cycle, which is the main important hub of metabolism, there are few enzymes which depend on riboflavin derived coenzymes, like, as you can see in the slide, succinate dehydrogenase, alpha ketoglutarate dehydrogenase and isocitrate dehydrogenase complex. All the three enzymes will require FAD as the coenzyme. Coming to lipid metabolism, in lipid metabolism there is an important pathway for catabolism, and that is called beta oxidation, and for beta oxidation there is a very important enzyme that is called acyl-CoA dehydrogenase. Now, for the action of acyl-CoA dehydrogenase, you will require FAD as the coenzyme. And in amino acid metabolism, you have an enzyme called as branch chain alpha keto acid dehydrogenase. For the action of this, you will need what is called as FAD. So, FAD is needed for carbohydrate metabolism, protein metabolism as well as lipid metabolism. Then, coming to the second important coenzyme derivative of riboflavin, that is FMN or flavin mononucleotide. Where is it required? FMN is required for amino acid metabolism, FMN is required in the electron transport chain. You are aware of this electron transport chain located in the mitochondria. This is the place where ATP is made. So, you need it for the action of enzyme L-amino acid oxidase, that is for amino acid metabolism, and in the electron transport chain there are many complexes, and which is the complex which has FAD? Role of FAD is in the complex 1. So, in complex 1 you have the role of this. Coming to the deficiency manifestations of riboflavin. Riboflavin manifestations are rare. Why is it rare? Because we have an advantage. We have microbes living in our gut, especially in the intestine. They help us out. It is actually a symbiotic relation. They feed on our food and in return they give us vitamins. So, we have the gut flora, we call it the gut microbiota. They will synthesize the vitamin called as riboflavin. So, rarely we undergo deficiency of riboflavin. And riboflavin action is chiefly in the maintenance of the oral mucosa. So, if any person has deficiency of riboflavin, definitely he will have some infections or inflammation in the oral mucosa. So, what are the findings of riboflavin deficiency? First one, chelosis. The lips start to fissure or crack. There is glossitis. The tongue undergoes certain inflammatory changes. What are they? The tongue will start appearing to be magenta color. So, it is a pinkish hue, so it is called magenta colored tongue, and there is also surface of the loss of the surface papilla. Then the person can also develop angular stomatitis. That means there is inflammation at the corners of the mouth. So, I told you riboflavin is for maintenance of the oral mucosa. So, what are the three important deficiency findings? Chelosis, angular stomatitis and glossitis. You can observe some changes in the eye also. It is called corneal vascularization. So, let us see some pictures. So, you can see here, this is the picture of chelosis. So, you can see the lips have fissured, there is little bit of angular stomatitis also. So, it is very clear here, the lips have fissured and also there is angular stomatitis. So, this is about the deficiency shown in the lips and in the angles of the mouth. So, one more picture for angular stomatitis, the picture for corneal vascularization, you can see the arrow mark, the magenta colored tongue, which is the characteristic finding of glossitis. So, that was about riboflavin metabolism, its sources, RDA, functions and deficiency symptoms. So, it is time to move on to one more vitamin, another water soluble vitamin. This time it is again from the B complex group, it is called B7 or biotin. So, let us start studying about biotin. Biotin is also called as a B complex vitamin numbered as B7. It was initially called as the anti-egg white injury factor. What is the reason for this? I will tell you now. It was Vincent du Vingard who isolated this vitamin first, and it is very important for all the carboxylation reactions in the body. It usually exists as a prosthetic group. If you recall your knowledge about studying on enzymes, you would have studied what is a prosthetic group. A coenzyme which usually is locked with the enzyme and you can't separate, they are actually covalently bound one to other. That one was called as prosthetic group. So, the perfect example for a coenzyme is acting as a prosthetic group is vitamin B7 or biotin, and it is actually behaving like a apoenzyme to the coenzyme, and the apoenzyme together will form the holoenzyme. What are the sources? What are the RDA? The sources for biotin, it's normal gut microbiota. Once again, the gut microbiota are capable of producing biotin. So, we will never face any biotin deficiency problems. Then if you are a non-vegetarian, you can rely on liver and egg. If you are a vegetarian, soya bean, peanuts, and for both of them, yeast and milk. What is the requirement? The daily requirement comes up to 30 to 40 micrograms for adults. What is the role in metabolism as a coenzyme? So, biotin coenzyme is called biotin itself. It is needed for carboxylation reactions. There are few carboxylation reactions very important in metabolism chapter, and before we go into those examples, we will see the role of biotin, which is very important in maturation of clotting factors. The clotting factors 2, 7, 9 and 10. These are vitamin K dependent clotting factors. Now, for the maturation of these 4 clotting factors, we will require the role of biotin. And for gluconeogenesis, there are 2 enzymes, they are called the key enzymes. So, you can see here there is pyruvate carboxylase and propionyl CoA carboxylase. Both these carboxylases will require the role of biotin. So, biotin is very important for gluconeogenesis. We also need it for lipid metabolism. We have a chief enzyme or the regulatory enzyme of de novo synthesis of fatty acid. The name of the enzyme is acetyl-CoA carboxylase. Acetyl-CoA carboxylase is the regulatory enzyme of the de novo synthesis of fatty acids. And then of course, for the urea cycle and pyrimidine biosynthesis, you have an enzyme called as CPS1 and CPS2. there also you need biotin as the coenzyme. Then you have the anaplerotic reactions, the reaction which will fill up the intermediates of TCA cycle. One of the enzyme which plays a crucial role in anaplerotic reaction is the malic enzyme, and for the action of this malic enzyme you will need biotin. I told you it was initially called the anti-egg white factor, right? That is because biotin has an antagonist. Where is it? It is found in the egg white. The name of the antivitamin is called avidin. Avidin is actually a glycoprotein found in the egg white, that is raw egg white. We are not talking about the boiled version. Okay. So, it has high affinity for biotin, it will bind to biotin and cause biotin deficiency. That is why they say if people go on consuming raw egg white, then what happens is there will be deficiency of biotin, but not to worry much, because you will need to consume at least 10 to 20 raw egg whites every day, that too, to develop biotin deficiency. So, that is avidin, which is called the antagonist of biotin. So, this property is encashed in the healthcare industry. There is a very good attraction, or what to say, tight binding that is observed between avidin and biotin, and this property of is encashed in the healthcare industry in two places. The first one is the avidin biotin system that is used in the ELISA kit. ELISA, as we know today, is so commonly used for detection of so many compounds and so many things. So, it is used in the ELISA kit, and also for labeling of DNA. Initially, they used to label the DNA for DNA studies with radioactive probes, but we all know that radioactive probes will have their own hazardous effect. So, today they are trying to replace it with this one. So, avidin biotin complex is being used in the labeling of DNA also. So, this is just a picture to show you how avidin and biotin have been used. So, if you look at the picture here, this is our biotin that has been labeled, and it will be attracted towards the avidin, and this property is being encashed in the ELISA. The entire picture here shown is the functioning of the ELISA kit in detection of a particular antigen. So, what are the deficiency manifestations that are seen in the biotin? So, deficiency may be seen only on prolonged antibiotic usage. The reason is we produce it in the gut. So, we should not develop deficiency even if we do not eat the sources. But the problem comes when a person is put on antibiotics. When he is on antibiotics, entire gut microbiota will be destroyed, and that is when we can have vitamin deficiencies. So, what are the symptoms? There can be depression, seborrheic dermatitis can be seen, and eye, mouth scaling, rashes can come, glossitis can be seen, muscle pain, anorexia and fatigue. How to explain the fatigue in biotin deficiency? Just a while ago I told you the role of biotin in gluconeogenesis. It is needed for gluconeogenesis because it is a coenzyme for two important key enzymes. So, if there is no vitamin, then there won't be gluconeogenesis. Gluconeogenesis is an important pathway that fetches glucose when you are starving. So, early in the morning there can be fasting hypoglycemia, and the person can faint or have issues of collapse. That is because there can be no gluconeogenesis, no blood glucose maintained, blood glucose can drop, there can be hypoglycemia, and the person may develop fatigue or can even collapse with lack of energy. So, that is about deficiency manifestations of biotin. So, we are done with the vitamin introduction. Then we moved on to study two important vitamins, that is riboflavin and biotin. Here are one or two questions just to recall the topic. Look at the question. Which among the following acts as a coenzyme for acetyl-CoA carboxylase? The moment you hear carboxylase, definitely the coenzyme is biotin. So, out of the four, it is the second option, which is biotin. So, biotin is the coenzyme for acetyl-CoA carboxylase. Moving on to the next question. Which among the following acts as a coenzyme for succinate dehydrogenase? Succinate dehydrogenase definitely requires the help of flavin derivative, and that is FAD. So, FAD, the first option, is the right answer for this question. That is, FAD is a coenzyme for succinate dehydrogenase reaction in the TCA cycle. The third question, which among the following is a fat soluble vitamin? This is ascorbic acid, retinoic acid, pyridoxine, pantothenic acid, whereas the right answer is the second option, and that is retinoic acid. So, retinoic acid is the correct option for this. Ascorbic acid, pyridoxine, pantothenic acid, they are all water soluble vitamins. So, the fat soluble vitamins among the four is retinoic acid. So, that was about the topic on vitamins, riboflavin and biotin. Thank you.